Hi, my name is Dr. Michelle Hirsch, and today I wanted to talk to you about how EndoAxis has helped improve my practice. I thought the best way to do this was to talk about a typical case that you might see. I chose a woman, 47-year-old female, who has fatigue, lots and lots of brain fog, weight gain, new for her. She's been exercising and the weight hasn't been coming off, most likely related to perimenopause. She has PMS and she has digestion distress, especially after eating. For this female, I decided to order her a Dutch Complete, a GI map test, and an ion Genova panel, which I know is not that common, but it's very similar to a Nutrival or an organic acids test. The main findings from my test results, I forgot to mention she did come with some blood work that ruled out anemia. Her TSH was getting a little bit low, and then she had low vitamin D. Her Dutch test showed she had that typical normal free cortisol, but very, very low metabolized cortisol. When we see that, we know that the liver is involved, the thyroid, mitochondria, and then she had very low DHEA. Her hormones were showing perimenopausal, lower estrogens, low testosterone, low DHEA. Her progesterone was normal. She's still cycling. Phase 1 estrogen detox was pretty good, other than her 3A4 was quite low, where I like to use vitamin D. Her main issue was her COMT was very slow, and I think this was causing a lot of her symptoms with fatigue, PMS. Her stool test showed high steatocrit, low elastase, clearly issues with digestion, and low secretory IgA, which I like to look at adrenals. Her ion test showed high beta hydroxybutyrate, showing a hard time getting carbohydrates into the cells. Her Krebs cycle was looking like she needed a lot of nutrients to help get that going, especially CoQ10. Her lipid peroxides were getting a little bit high, needing some fat-soluble vitamins, and her vitamin D was low. So putting this all together, I'll show you a typical program I was working on prior to using EndoAxis. My common problem I had for many, many years of having these long lists of amazing supplements and nutrients that are needed, but just where do you start and how do you limit this? Because I can't give a patient this many supplements. What I was thinking as far as for the adrenals, I wanted the B5 and adaptogens and licorice root, DHEA, lots of blood sugar balancers. I wanted some selenium and tyrosine. For her slow COMT, always wanting to use this group of ingredients. For her low hormones, there's a bunch of different herbs we can use here. I just picked up the main ones that I like to use. And then her digestion, some taurine, pancreatic enzymes with oxbio. And then for the ion, I listed all the nutrients that she was really needing for the mitochondria support and the lipid peroxides. And so you can see them all here. 30 products. So I put her Dutch Complete into the EndoAxis program. What I've done is I've changed my questionnaire to line up with the same questions as the EndoAxis questions, which makes it very easy to plug in the information. And her main formulas that came up were number 19, which is for the adrenals, number 3 for the slower COMT, and number 7 for the perimenopausal hormone decrease. She also got the add-on formulas, number 4 and number 23. I don't always use the add-ons. I often give them as an option. In her case, you'll see I did use 23, the DHEA. Number 4 is recommended a lot when you check off PMS, and it's always a nice thing to give as an option. And then you can see on the left side is what's in number 19, and if we look closely, you'll see a lot of ingredients that I had on my list. And then on the right side, we have the number 3, which is for the COMT. It's a dream supplement for me because for so many years I've been having to use so many products to try to get the COMT much faster, and now we have an all-in-one. Very hard to see this, but number 7 has lots of those herbals to boost up the testosterone and the estrogen. I thought it would be easier just to look on the chart I made, and you can see how all of these fit into 4 EndoAxis products, and one of them was just the DHEA. So lots of the adrenals things fell into the number 19, the thyroid all fell into number 19, the COMT fell into number 3, the hormones fell into number 7, and even digestion, we picked up the taurine. What I'm finding amazing about the EndoAxis product is also that most of the nutrients that are needed on a patient's organic acids test are coming up in their main programs. And so I've stopped running the organic acids for now because it's saving the patients a lot of money in testing, and I'm getting all of these nutrients covered in those main products. So what I did is I made a new supplement program with the EndoAxis products so you can see how much more palatable this is for patients. You can see this is with the EndoAxis products. Since the products only have numbers, I like to write down what the products do next to the products to help the patients get more familiar with them. But you can see I have number 19, number 3, number 7. I write down the dosage. I have DHEA. I thought that would really help this patient, even though it was optional. I picked up the vitamin D since that wasn't in the products, and then I added a digestive enzyme with ox bile. And then I gave the optional number 4 if they wanted to help their PMS faster, though I do tell them that the program that we're using right now is ultimately going to be working on the PMS. It's just that if she wants it helped faster, the number 4 would be a good investment. And then I just put the choline in her diet with a high fiber and low sugar diet, which I do for a lot of my patients. And if you add these up, we have 6 products, which I think is completely fair to ask our patients to do. So to highlight my 5 favorite reasons for using EndoAxis, number 1, I have a much lower amount of supplements. Number 2, these supplements I put into Fullscript. I do it on my own. I do not use the EndoAxis Fullscript add-on because this allows me to add the vitamin D and the digestive enzymes. I just do a search on Fullscript and add them one by one. And what I love is I hand this off to a patient and they're not going to go on Amazon to get faster shipping because they can only get the EndoAxis products on Fullscript and there's nothing like them. I fully trust every ingredient that was put into these products and that helps me a lot, especially with my sensitive patients. I know what they're getting is high quality. I've been using these products since June and I have been seeing much faster patient results as far as their health getting better. And like I said before, I haven't been using the ion or the organic acids test as much as I used to because they're coming up so much. And so there's less tests needed, which is an incredible discount for the patients at the beginning. That's it. Thank you so much to EndoAxis for making my practice better. I highly recommend you check them out.